Hello, everyone, and welcome to this audio podcast. This audio podcast is part of Cortex Narrate series, and this audio podcast is part of a Cyclone Cascade. This audio podcast is part of a Coachella Blitz, and this audio podcast is part of a Storm Bostic production. So now I'm going into some guidelines in context. So investigations have highlighted who should be tested or screened for CKD in order to assess the disease risk. In order to assess disease risk and progression. Frequency of monitoring should be agreed with recipients or patients according to underlying cause, past patterns of EGFR and ACR comorbidities, adjustments in treatments, and whether on renal replacement therapy or form of renal replacement therapy or consecutive treatment modality. Guidelines on the management of CKD indicate that patients should have frequent tests to monitor those at risk using EGFR and albumin creatinine ratio or ACR less than 3 milligrams per millimole and look for any other indications of renal disease. Another amendment to guidelines has involved not testing or screening people with EGFR creatinine of 45 to 59 ml per min at CKD stage 3A. However, if recipients or patients are not screened or tested during the early stages of CKD, then diagnosis will be delayed and the opportunity for early intervention to slow progression of the disease would be missed. The patients or recipients in stages 3A and 3B in CKD stages 3A and 3B generally require sort of a routine checks in around EGFR. However, the split classification between CKD stages 3A and 3B can result in confusion, and it is and suggested that a further stage or CKD stage 6B included, and that CKD stages 3A and 3B are replaced by a single stage CKD stage single stage CKD stage 3, because the EGFR margin is on the laboratory reference range is narrow, and there also should be appropriate terminologies associated with the CKD stages, and there should be broader screening opportunities and collaborations. So so that draws this audio podcast to a close. This audio podcast to a close. This audio podcast as part of a Cortex Narrate series, an audio podcast as part of a Cyclone Cascade, an audio podcast as part of a Coachella Blitz, an audio podcast as part of a Storm Robotics production.